Allergy is not a one-time visit to the doctor. You need to come and regularly meet up with the doctor. Like I said, some of them are seasonal allergies, some of them are perennial allergies. So you need to meet the doctor initially at least once in 3 months. When a mosquito bites you, you see that swelling that comes up. That is also an immune response. He was fed with minute doses of these poisons on a regular basis in his food, and over a period of time the dosage was increased till it went on to highly toxic doses, but the body got resistant to it. You must complete the full course of immunotherapy. Hi friends, thanks a lot for following me, and I hope that you'll continue to follow, subscribe and share my channel Dr. Gladson Explains. So in this video we'll talk about how we manage allergies. Now, like I told you, the immune system has a memory, a long-term memory. So the ultimate solution for the treatment is to treat your immune system, to calm it down. This therapy is known as immunotherapy. Here we introduce the same allergen. First we do allergy testing on you. They are in the form of skin prick tests, where we put 1 drop of the offending different allergens onto your skin and then make a small mark with a lancet just under the droplet. And we see whether your body responds to that allergen, whether your immune system responds. How does it respond? By when a mosquito bites you, you see that swelling that comes up. That is also an immune response. So similarly, that is known as a flare. Now the flare is the reddening and the swelling is the wheal. The flare and wheal, and depending on the size of the flare and wheal, we know how severe the allergy is. This we compare to 2 things. One is histamine, which is the mediator of inflammation. So histamine will have the largest response, and 0 response is plain swelling. So this test is known as the skin prick tests, and this is the gold standard in allergy testing. So based on this, your allergist will be able to identify these are the allergens which need to be managed. Now some of the allergens can be managed, can be avoided. For example, if you have got, say, wheat allergy, you can avoid wheat. That's the simplest form of avoidance. But sometimes these allergies cannot be avoided. For example, in case of a patient of mine, he was a barista at one of the very popular coffee chains, and he turned out to have coffee allergy. So we couldn't do anything about it. So I had to ask him to take a break from being a barista for a couple of years, and then we put him on immunotherapy. Basically, immunotherapy is a concept which is very Indian. You have heard in the mythological stories of Vishakanyas, and the concept is very similar. Basically, your body is slowly habituated to that protein. It's not only in mythology. Chanakya used this to protect his kings, like Chandragupta Maurya. He was fed with minute doses of these poisons on a regular basis in his food, and over a period of time the dosage was increased till it went on to highly toxic doses, but the body got resistant to it. This is the concept here. So when you have an allergen, we know that the immune response to that allergen is, say, 1 particular dose, let's say 1. So we dilute that to 1,000th of that dose of the immune response dose, and that we start as the first dosage. It comes in the form of vials, sublingual vials. Basically, we take and give one droplet under the tongue. He has to do it on a daily basis, keep putting droplets every day in the night before going to bed, put one droplet under the tongue, it will absorb from there, create the immune response, and that's how the process goes. This is the only way we can cure this is by persistence. We have to keep doing this. Gradually the dosage is increased from 1,000th of a dose to 1,000 times the dose over a period of around 3 to 5 years. And finally, we can certify that the patient has got desensitized to that particular allergen. Now, this requires a lot of patience and it's quite expensive. So what do we do that the patient does not lose interest in this? So we have to treat the patient symptomatically. Now, during this process of these 3 years, you may get some acute allergic reactions. So we need to treat symptomatically with some antihistamines, anti-leukotrienes, nasal sprays, gargles, of course, and jalneti. That's another wonderful feature of avoidance of allergies, which I'll explain in the next coming videos. So all these put together we are able to manage allergies. Allergy is not a one-time visit to the doctor. You need to come and regularly meet up with the doctor. Like I said, some of them are seasonal allergies, some of them are perennial allergies. So you need to meet the doctor initially at least once in 3 months, so that the doctor is able to understand what care and what attention you need on a regular basis. And also we need to solve other things. For example, your repeated sneezing, you may end up with sinonasal polyposis, which may block your nose. So we may need to do some surgical correction to free up that nose. But these are all temporary procedures and they can keep coming. But what we shouldn't lose sight of is the immunotherapy that will keep going on throughout this period, because only that is the final cure. You must complete the full course of immunotherapy. And it may not be for that one allergen. You may have 2 or 3 allergens. Sometimes we may be able to add the 2 or 3 allergens in the same course of immunotherapy, but sometimes these allergens may cross-react. So we may have to do it in specific steps. We may start off for a few months with one allergen, and then once you've got a little desensitized to that allergen, we'll proceed with adding the second allergen immunotherapy. So this is how we'll go on to immunotherapy. We do have processes where patients are not patient enough. They would decide, can you hasten up the process? Yes, we do have. We can start off. There's something called a rush immunotherapy, which is done in the hospital where you are admitted for around 15 days, and what we do over 3 months, it is hastened to those 15 days where immunotherapy is given. But why are you hospitalized for that? Because it carries a higher risk. You are anyway dealing with something that is poisonous to you. So you must understand that we have to monitor you to do rush immunotherapy. It is not meant for everybody. It's meant for those people who are not patient enough to go through the entire process, and it is much more expensive since you are going to be in a hospital bed for 2 weeks. So you have to take care of those costs and all that. So that is why rush immunotherapy is a solution which is available, but very few of my patients I would recommend it. I would rather go in for the patient approach, treat you symptomatically, and give you a solution which does not affect you physically as well as financially. Don't forget to subscribe, share, and like my videos. And in the next video, I will be elaborating on further managements like Jalaneti, for example. Thank you.